Arthrofibrosis, open removal of scar tissue. This video gives information about open removal of scar tissue for arthrofibrosis following knee replacement. When physical therapy, manipulation or anesthesia and arthroscopic removal of scar tissue fail, open removal of scar tissue is considered. This procedure is also called open lysis of adhesions or open arthrolysis. The procedure is usually performed between 6 months and 1 year after knee replacement. In this procedure, the knee joint is surgically opened and the scar tissue is removed from within the knee joint. Also, soft tissue structures and adhesions could be released as needed. The posterior cruciate ligament, if present and is tight, it could be released. Also, the posterior capsule of the knee could be released as needed. The procedure is helpful in removing the scar tissue from within the knee joint as well as from outside the knee joint. The scar tissue between the quadriceps muscle and the bone can be released. Soft tissue release and lengthening can be performed as needed. With the availability of arthroscopic instruments, open removal of scar tissue is rarely performed alone. It is performed more commonly during revision knee replacement for arthrofibrosis as part of the procedure.